Michigan's chief medical executive says we should prepare for the virus to continue to come in waves.
Right now, things appear to be trending in the right direction, and the state is making changes. Today, Michigan reported a 3-day total of 1,860 cases and 26 deaths over the last 3 days. So that breaks down to an average of 620 cases per day, which is the lowest number we've seen going all the way back to early August of last year.
Michigan is dropping the mask mandate for most state employees starting Thursday.
Today, the mask mandate ended for schools in Oakland and Washtenaw counties, but the Detroit Public Schools Community District says it's going to hold off until mid-March before considering doing the same thing. Now, with all these changes, our Grant Herms got to talk one-on-one with the state's top doctor. Grant.
Hey, good evening. Dr. Natasha Bagdasarian says the pandemic isn't over yet. Even though we are moving from a response to a recovery phase, is how the state is talking about it. She says we should be ready, though, even with Omicron behind us, to expect COVID to come in cycles as we move forward.
The state's top doc giving a better look at the next step in the fight against COVID as the Omicron surge comes to an end.
I really want to convey this idea of it's not a straight line to the finish. We're not saying the pandemic is over, but we are conveying that this is a relatively safer time compared to what the last few months have looked like.
Dr. Natasha Bagdasarian saying the change is being driven by lower case numbers, lower hospitalizations, and more ways to treat and prevent the spread of the virus, like monoclonal antibodies. Although she stresses vaccination is still the best way to protect yourself against the virus.
So if you start out from a place where you are vaccinated, and you are effectively using other tools, then you have your best chance at protecting yourself from severe outcomes and death. So it's not an either or. This should be an and type of scenario.
The shift has also come under scrutiny after new reporting showing a Democratic strategy firm urged top Democrats to make the exact kind of changes we're seeing now. When asked, Bagdasarian says she doesn't mix politics and public health.
My background is as an infectious disease physician and as an infectious disease epidemiologist. And so none of the advice or recommendations that I'm giving to the people of Michigan or that I'm advising to my colleagues at the state are based on anything other than disease transmission and how these outbreaks work.
Now, one other thing that Dr. Bagdasarian says will be crucial as we move through this next phase is available testing. There are 500 million tests from the federal government that still haven't been given out. She said we need to get those into the hands of people so they can track if they have symptoms so we can catch the next surge as soon as we can. Back to you.
Grant, there are still those places not lifting mask orders or maybe lagging behind vaccine rates. Detroit schools among those. So what'd she say about people who live in those areas?
She said it's really important to keep track of the spread and the vaccination rate in your community, the hospitalizations in your community, to make sure that you can plan ahead and make the safest choices for you or to mitigate your risk as much as possible, even as we do see those lower numbers across the state. Devin?
Yeah. All right, Grant.